Let's give it a few seconds. All right. And we're live. Good morning, everyone. Welcome and thank you for joining us. Today, we're having our County of Santa Clara Career Event Speaker Series. We are here to learn more about our department called Valley Health Plan. I'm so happy to be here because this is another gem that the county has, and I cannot wait to share with everyone on how great this department is. And my name is Oriana. I'm a senior recruiter with the County of Santa Clara's Employee Services Agency. We're the HR department. If you have any questions during this event, feel free to drop them in the chat. We will have a question and answer session at the very end. And this video will be recorded, so if you can always go back and watch it later, okay? Before we introduce all of our speakers that are with me today, I would like to show everyone our current job opportunities. There is a quick page that we would like to show you and share with you. I will have my colleague share his screen. There we are. All right. This is a digital flyer. So you can scan this code with your phone or type in the link on the bottom, bit.ly/SCCVHP jobs. It will take you to a quick links, because I have been getting a lot of questions about, can we see all of the job opportunities ahead of time? So there we are. You can visit this website for all of the available opportunities. All right. Thank you for sharing the screen. And I see more and more people joining us. This is wonderful. Welcome, everyone. Let's get started with our introductions. It is my honor today to introduce our speakers today. We have Laura Rosa, our VHP Chief Executive Officer, here with us today. Thank you for joining us, Laura.
Thanks so much. Good morning, everybody.
And we have Joeldin Ang, our healthcare analyst, here with us today.
Hello, folks. Good morning. Welcome to this wonderful event.
Thank you. And we have Diano, our IT manager, with us today.
Hello, everyone. I'm excited to be here.
Thank you, everyone. Let's talk about all of you. Could you introduce yourself and the team? Let's start with Laura. Laura, can you talk about your background and experience and how long you have been working with the department?
Thank you so much. So I've been with VHP since November of 2019. Prior to that, taking on the role of CEO of VHP, I was a chief compliance officer for the Santa Clara County Health System. So that's all our hospitals and outpatient clinics and behavioral health. Prior to that, I was at Stanford University in the privacy office. And prior to moving to California, which we did in 2017, I was in Washington, D.C. at the U.S. Department of Health and Human Services.
Thank you, Laura. Thank you for your introduction. Let's move on to Joeldin.
Cool. Hi, guys. Joeldin Ang here. I've been with Valley Health Plan for the past 5 years. I've gone through various positions and departments here, starting with provider relations, provider contracts administration. Then after that, provider relations. I was then I was a disaster service worker, but we can talk about that later, and also network development. Prior to that, I was with Verity Medical Group, which was Verity Health System, which was the previous owners of O'Connor Hospital in St. Louis. And then prior to that, Daughters of Charity Medical Foundation, and also San Jose Medical Group. So I've been working in the contracting department and working with providers for the past 25 years in the healthcare field.
Awesome. Thank you. Thank you for your introduction, Joeldin. And we have Julie. Julie, can you talk about yourself?
Yes, absolutely. Hi. I'm currently an IT manager here at Valley Health Plan. I have spent 16 years in IT in various roles, 10 of which have been specifically in healthcare IT. First started my career actually working for a data management company as a market data analyst for investment banks and security firms, and then landed in healthcare starting at Kaiser. I've worked for a startup, a software development startup, um, and then began working for the county. So for the majority of my time here at Valley Health Plan, I've been responsible for project delivery in varying capacities for the IT department, overseeing projects myself, but now managing our project management office that we have in place today.
Wonderful. Thank you so much, everyone, for being here today. It is our pleasure to have you at our event today. And I've heard so much good things about working for this department and how great our leadership is, how great our culture, our values are. And we definitely want to share that with everybody joining us today, whoever is interested in learning more. So let's talk about our departments and what we do. Let's start with Laura. Laura, could you provide us an overview of our department? What are our divisions? Who are our clients? And what you want to share with everybody today?
Sure, thanks so much. So we're a health insurance company that's actually a department of the county. So we're a Knox-Keene licensed health plan. We're an HMO. We provide insurance to county employees, including IHSS workers, as well as Covered California, which is an Affordable Care Act program, and what's called a mirror program of Covered California. We're the only insurer in the state who provides a plan for undocumented for IFP called Individual Family Plan. We also provide Medi-Cal coverage for about 145,000 members who are delegated to us. So we have about 211,000 members, as we call them. So we're now kind of a medium-sized health insurer. And we have many departments. Since we're fully licensed, we have a lot of regulations to comply with, and we have a lot of providers as well. We have tens of thousands of providers that are part of our network. We have member services, we have claims, we have a finance department. We also have billing enrollment, which is part of our finance department. We have appeals and grievances for members and providers. We have a marketing part of our organization under our Chief Business Development Office, also broker sales and engagement for that's how Covered California members often join, is through a broker. So you have a lot of brokers that are part of our program. We have a very large IT department, and we're currently implementing Epic, which is on the hospital side, but now we're implementing Epic's Tapestry program, which is for the health plan, and all claims and medical management and all of that will be on Epic. We have a medical management department, which includes utilization review, which is usually done by nurses, as well as a very large case management department that works directly with members on their health concerns. So it's a large department. We've got about nearly 300 employees. There's lots of opportunity. We're growing. We recently started providing Covered California in Monterey County and San Benito County, and we're also providing coverage for county employees who live in San Benito and Monterey counties. So we're a growing organization, always taking on more work. We recently took over a large part of the county's charity program called Primary Care Access Program for the ambulatory side. We're administrating that. So would love to have people join us, and I'm really excited to be here today and speak to you about VHP and what we do.
That's wonderful. Thank you for talking about all the divisions. I think a lot of people were wondering about that. So let's move on to Joeldin. Joeldin, could you talk about what you know about this department, how you like working with the VHP so far?
Sure. The current department that I'm with is called Network Development, and we are in charge of contracting with providers, providers here in Santa Clara County, and also, as Laura mentioned, we're growing into Monterey County. Honestly, I love my team. I love my team members. I love my boss. I love the VHP organization. We provide growth within our departments. I myself has grown within VHP within the past 5 years, talking about where I entered as in provider contracts administration, then moved on to provider relations, and now to network development. So VHP is a wonderful organization that supports internal growth. And I know a lot of my coworkers here at VHP have grown within various departments from the ground going up. That's one of the wonderful things I love working here. Also, we have diversity here at VHP internal. We have diverse people where you talk about different personalities, different nationalities, or what have you. And everyone, especially I'll speak with for my department, we all have different strengths within my department, which is really cool. One thing also I like is we have our all staff huddles. I think we improved communication, and it starts from the top going down. So every week we have our huddles where we talk about COVID updates and current events, and it's just an exciting place to work at. And I'm just glad to be a part of it.
That's great. That's great. I see more and more people joining us, and welcome everyone. And I would love to have Julie shared about her experience working with the VHP departments. And then we'll be moving on our opportunities, because I heard a lot of our people wondering what are the jobs we have available, entry levels, nursing levels. So let's have Julie talk about working with the department first, and we'll get to that very soon.
Yeah, definitely. So, it's very exciting. The organization is growing. Our team, the IT team, is growing. And so just, with the number of opportunities that we have available now, it's just really exciting times as we, go under this transformative change and continue to evolve. Within, the IT structure, we have opportunities that are available in each one of our functional teams right now, and definitely we'll go and we'll talk more about those opportunities. But just to talk a little bit about the org structure, we've got opportunities available in our data management area, in our production support and IT operations area, our project management area, which I oversee. And then we've created 2 brand new teams as a result of our Epic Tapestry implementation, which we call our business operations support team and our clinical operations support team. So definitely during these times, things are very exciting, very dynamic and fast paced, because we are in the middle of an implementation. What I like about working here at VHP is we have the opportunity to collaborate with every operational area, which gives us a lot of insight into the health plan operations and what the organization is doing as a whole. I personally enjoy problem solving, working with the organization, and I'm constantly learning everything new every day. Given the years that I've been at the health plan, I've been witness to the growth. I started at a time where we built the IT department from the ground up. So it's been tremendous to see the growth and how things have changed over the years. We're always looking for new ways to improve, ways to be innovative, gain efficiencies, and the outcomes of that continue to push me forward to contribute in the best way I can. And that's why, I enjoy working at VHP and continue to do what I do here.
Wonderful. Thank you, Julie. Thank you so much for sharing that. I hear collaborations, I hear diversity, I hear that everybody's enjoying working for the department. That's really awesome to share with our audience today. And I see more and more people asking, what are the opportunities? So if you look at my background right here, have a QR code for you. So anybody who is wondering about what jobs are we hiring for, you can scan the QR code or you can visit this website right here on my background. And I would love to have our speakers elaborate on that because Laura mentioned about Epic, and I know Julie's mentioned about the expansion of the department. I would love to have everybody talk about our opportunities and qualifications and our schedules. And I got a lot of questions about remote working as well. So can you share with us what you know about the current opportunities? Let's start with Laura. Please, Laura.
Sure. So we're hiring to support the Epic implementation, and Julie can certainly speak to that. We're also hiring for contracting roles. These are roles that include going into physician offices and working both remotely and in person with hospitals and provider offices for contracting purposes. We want to add providers to our network. We need to add hospitals to our network. So there's the work of actually speaking to providers about VHP and what it's like to work with us. And then there's another part of the contracting, which is helping to draft those contracts and put the language in and work across the organization to make sure that those contracts are according to the template and with compliance. So those are some of the contracting roles, and Joeldin can speak to those as well. Beyond those roles that where we have these two experts here today who can speak to those particular parts of the organization, we're also looking for roles, for example, such as a director of quality, which would be a nursing role. That's an area that we're trying to recruit for. And we have a number of other open positions that we're recruiting for. So that gives you some idea of what we're looking for.
Great. That's great. Laura has touched up on what type of all types of recruitments we may have opening for. But Joeldin can tell us more into details about some specific ones, right, Joeldin?
Yes, absolutely. There's been a recent posting on provider relations specialists. And I think there's two that's opening in Monterey County to support that area, Monterey County and San Benito, and also here in Santa Clara County, since we're growing and trying to get more providers. And in that provider relations specialist role, they're more of like a liaison between VHP and the providers. So they're like the face of VHP, let's say. So we need people who are comfortable with speaking with providers, physicians offices throughout these various counties that we're in. And also these specialists will be doing, provider relations specialists will be doing orientations about VHP, Valley Health Plan, orienting the providers and their offices about authorization processes, claims, and various questions. And if they're like the go-to of VHP. If a provider has a question, they would have this provider relations specialist to go to. We also have positions, as Laura mentioned earlier, in network development. And 4 years ago, when I was, 5 years ago, but rewind 3-4 years ago, the network development department used to be only one person. Now it's grown to at least maybe 6 or more people, and we need more people because of our vast growth, especially in Monterey County, which we just expanded last year or earlier this year. So we have various positions such as a network development senior management analyst position, and they would be working on negotiating and monitoring contracts with various providers, and also preparing some sort of cost analysis to evaluate providers to see if they're a good fit for Valley Health Plan. Another position that's come up as well is a network development or a program manager 2 position, and they would be in charge of implementing and controlling the contractual relationships that we have with various providers, and possibly negotiating more complex contracts with providers, which would be possibly hospitals and so forth. They would be directing and evaluating staff, overseeing staff. So these are some of the various positions that will be with network development and provider relations as well.
And we're also We're also hiring for a provider relations manager.
Oh, great.
Yep.
Yes. Speak to that, what Joeldin and Laura just said. When you're scanning this QR code right here, it takes you to a quick page. Even you cannot find some of the positions they mentioned, but they will be posted in the future, just so you know. Scroll down to the bottom. There are some future opportunities listed on there. So don't worry, they will be posted if you cannot find it on this link.
Exactly. It's not posted yet, but it's coming.
Perfect. Thank you, Joeldin and Laura. And IT opportunities. I'm sure people are very happy to hear that. Julie, could you share with us about the IT opportunities we have?
Oh, we have so many. Do we have enough time for me to go through all of these?
That's great.
Let me start with our with the positions that were created because of our Epic Tapestry implementation, our change to our new system here. So we do have both the senior Epic Systems Analyst and the Epic Systems Analyst positions out there. Really, the intent for these positions is to provide that direct Epic application support. So, right now with the ESAs that we do have on board already, they're involved with the implementation. It's all about the implementation right now. They're involved with the build and configuration of the system, involved with the testing, documentation of workflows, involved with the integrations within the system as well. I know you'll probably provide this information either, but there will be a certification requirement later on, which needs to be completed within the 6 months of employment. And so that is a requirement. Within our ESAs, there's actually 4 classifications. So 4 classifications of analysts, that is. So we've got our claims analysts, the membership, medical management, and healthy planet are the 4 core areas for the ESAs. Within our project management area, we also have IT project managers and business systems analyst positions that are also out there. Our IT project managers are overseeing and managing and controlling the projects from start to finish. So they're involved with, providing project management services through initiation, planning, executing, all until the closure of the project. They're involved with our executive team, with our stakeholders in defining the scope, timelines, project management plan, and documentation for these projects. Our business systems analysts work alongside our project managers and help with gathering business and functional requirements, involved with defining testing plans, and then directly involved with driving user acceptance testing as well. Within our data management area, we have resources that are involved with both the integration side and reporting side. The positions that we have out there are actually the business intelligence analysts. We also have the senior business intelligence analyst, and then also the senior integration analysts. And so being that they function within the data management area, that actually crosses over in a lot of the data management areas from the delivery of the data to, our data governance as well, data warehouse as well. As far as their day-to-day, at least for the integration analysts, they're involved with the management of integrations with our third-party vendors and third-party entities. As far as our business intelligence analysts, they are providing reports and data extracts for the organization as well as external entities. Let's see. We also have, I think I might have touched on all of them a bit.
While you were speaking, while you were speaking, we already got questions about Epic. do we, for the Epic related positions, are we requiring Epic experience?
Yeah, so it's definitely a plus if there is Epic experience. For the senior, there is a certification requirement. For the journey level, there isn't a certification requirement off the bat, but there is a requirement to complete the certification within 6 months. So given the classification of analysts that are needed, there are very specific Epic certifications that are needed. So if anyone out there has Tapestry specific certifications, then that's definitely something that we're looking for. But for that senior, it doesn't have to be specific to Tapestry, but it could be a certification in other modules.
That's great. I love what Julie just did. She just went through our opportunities in detail and the qualification. Thank you, Julie, so much for doing that. And I see audience appreciating you answering their questions too. This is great. And everybody who just joined us, there is this page. You can scan a QR code with your phone and you can see all of the open positions we have posted. Don't worry if you don't see those that you're interested in that's not posted right now, because they will be posted in the future. And as far as I know, the ones that are open right now are Epic Systems Analyst and Senior Epic Systems Analyst, and we have the Provider Relations Specialist position open right now that you can apply today. Okay, this is great. Anybody else want to add on the opportunities we did not cover? We have another question about entry-level opportunities. Anybody want to take on that question about entry-level opportunities?
Yeah, I can start. We definitely have entry-level opportunities. Some of those codes might be an Office Specialist 3, also Management Aid, and even maybe Associate Management Analyst might be considered more entry-level. And those are like more on the business side. Julie and Joeldin, any thoughts on what would be entry-level, maybe in your departments or other areas?
I can't think of anything at this time. I'm not sure if extra help is also an opportunity in
That's a good
areas,
point.
Yeah, we have, I'm sure, extra help opportunities in various departments where they can come in for a certain period of time to gain experience also about VHP. I don't know if Julie, if you have anything to add in your area.
Within IT, I across the positions, there is experience that is required. I wouldn't necessarily categorize these as entry level. Maybe entry level for the applicable area in terms of a position being a journey level position, but I don't think entry level in the sense that the question is being asked right now.
Okay, that's no problem, because this is a perfect time.
There is years of experience applicable for these positions, so
okay.
Just wanted to make
sure that. Thank you.
Another area that we're hiring for is credentialing. So credentialing providers, which involves reviewing their education and their licensing, and then helping us ensure that the data is accurate so that it can be given to our provider data management team and they can upload that. It's all part of how we track data, which is incredibly laborious and very important, which is why we're moving to Epic in some ways. So we've got a number of credentialing positions that are also will be coming open very quickly.
That's great. And while you were speaking, someone asked, are these full-time permanent positions or some of them are contract positions? Could you speak to that?
They're all full-time. They're all full-time permanent.
Wonderful.
Right, Julie? I don't think there's anything that we're doing that's
no, they're all full-time positions.
Yeah.
Wonderful. Someone asked about the marketing opportunity, marketing and communications in business development.
We definitely have opportunities there as well. Particularly, we're looking for good writers someone who's got a really good sense of editing and understands healthcare. I think one of the most important things we're looking for are people who are passionate about healthcare. We're obviously not here for profit. We're part of the county. We need to break even, but we're not here to be a for-profit. So we're really trying to ensure that we're reaching out to people who may need coverage so that they have access to healthcare, and being able to draft materials that the people can understand. Healthcare is so complicated and so difficult for people to navigate. So being able to distill that into things that are easily understood and compelling, that's an area that we're really looking for sure. And that would probably be a program manager 2 role.
That's wonderful. I hope that answers person's question about that. And we got more and more questions about remote working, hoping for Laura to address that. I know Laura, her philosophy is so wonderful. Laura, could you shed some light on that?
Sure. So we're a hybrid environment. Most people are in the office 2 to 3 days a week. I'm here 3 days a week. Others are here 2 days a week. And it really comes down to, the telework, as the county that county policy is a privilege. It's not a right, and it needs to be in line with what the business needs. But I'm a big believer in telework. I actually was working on telework before the pandemic. The pandemic just sort of made that an easier through path. But I do believe that we manage for outcomes. We've been really successful since we've gone. We were very successful during the shelter in place, and we've taken all those lessons learned and the technologies that made us successful and move that into our hybrid work environment. And so that's allowed us to both be really effective when there is something, for example, when there's a fire and there's an outage, we're able to move in and out of the office. There were times when there were outages and people lost power at their home, and they were able to come into the office even when it was not their day. So we're very flexible in making that work. And I think it also allowed people our ability to increase diversity, because people can travel a little bit of a longer distance if they're not coming in 5 days a week. So we're very supportive of that. We are also looking to move to Silver Creek, which is South San Jose, in 2 years. We're doing a full build out of a building down there that's county owned. And so we're really excited. I think that'll be a really comfortable and welcoming space to work. And so lots of exciting things happening at VHP, definitely supportive of telework.
That's very exciting to hear about that, because I've got questions about our location. You answered the question, but right now we're located in South and First Street.
Yeah, 204080 North First Street. Central San Jose.
I'm very glad to hear our department values employees' flexibility and just very respectful, and we're just result oriented, right? We look at the result instead of other things. This is great, and we have more and more questions coming in. And there were questions about the nursing positions. Laura touched up on that. Could you talk more about the nurses?
Sure. So we have nurses working in utilization review. So that would be, for example, a patient may need an MRI or they may need surgery. There are certain parts of our benefit package that requires a prior authorization. Our nurses do most of the prior authorizations, though some of those will be escalated to our physicians. And we have 3 full-time physicians who work at VHP, and when we have 2 part-time physicians. So we have about 45 nurses. We also have nurses that are working in our case management team and also leading our case management team. We have our director of case management is a nurse, as well as some of our supervisors. And then we have nurses who work in appeals and grievances. So we definitely have a lot of clinical staff. A lot of our work, even though we're not a provider, is clinically focused. We really do try to focus on the patient and make sure that they're getting the care they need from a clinical perspective. So we definitely have RNs.
Wonderful. I think that should answer a lot of nurses' question about the nursing opportunities. This is great. Thank you, Laura.
or yeah, I work directly with a lot of our case managers, our nurses, and they're the ones who help provide feedback on the different providers that we need in the area, various specialties. So, they're really helpful. Nice to have that communication.
I think that's the really exciting part about VHP is that we do all work together, and it's really becoming like a beautiful symphony where, as Joeldin is saying, we have nurses saying, hey, we really need nephrologists. Can you contract for more nephrologists, for example? And then we work with our business development team, and where are those, and how do we reach out? It really does become like a very a holistic sort of effort to make sure that we're running on all cylinders. So it's very exciting because we can really solve problems in real time, and we do it through internal communication.
That's great.
Just to add to that a little bit, I think, with this pandemic and having to have the shelter in place, a couple of years ago, it has taught us we had no choice but to work with each other and communicate through Teams or emails, and it's been a wonderful experience of growth within VHP and being able to gel and work with each other across all departments.
That's wonderful. It's all about collaboration, like a big family right there.
Yes, it really is. It truly is like a big family.
And we've hired quite a number of staff and leaders through the pandemic, and I think that has helped. The wonderful vibe the family vibe that we have here at VHP.
And we've retained our staff by and large. We've not had many people leave, which is also really exciting. Our growth is based, and the reason we're hiring is not because people have left. These are new positions. We have had some retirements and we've had some people move away, but we've been surprisingly successful at retaining our employees during a time of like the Great Resignation and a lot of turnover in other places. So really excited about that. And I think it speaks to our morale and how excited people are on the work that we're doing.
Yeah, for sure. That definitely speaks to stories about that. People feel a sense of belonging, love working for the department, and that's a result of that. And that's great.
I'm going to share like a little example. Okay.
Yes.
So Laura mentioned about us moving in 2 years to Silver Creek, right? So we had a whole VHP picnic or outing to see the new site. And the executives of VHP has allowed us to vote on like the different floor coloring, the whole different what do you call it, the palettes and color schemes. It's they're involving us, the workers, with these decision making.
Oh, that's really sweet. I love that feeling when you're just part of a family and you're part of the organization. That's
Not
really
like every family is not perfect. Neither are we. But hey, it's just a wonderful place.
That's really great to hear. And what is everybody waiting for? Join the team. Scan the code. All right. I love what we talk about. And while we were speaking, there were more questions. We had a question about the interview timelines. I will definitely address that later on with all of the steps of the recruitment process timeline. And there is question about the clinical R&D, research and development position.
No, we don't do that because we're not a provider. So we don't do clinical research and development or clinical trials. That would be more on the Valley Medical Center side, where there is research going on. And a lot of that research is often collaborative with Stanford, for example, but not at VHP.
Gotcha. Thank you for answering that question. How about work schedule? How is our hours at VHP?
It's business hours, Monday through Friday, 9 to 5, roughly, more or less. I mean, there are people there's a little bit of flexibility there, but not a whole lot. We really do stick to business hours.
Gotcha. Thank you, Laura. I bet you everyone is looking at our website right now because there's a question about the website, something listed on there. Senior Management Analyst Provider Network. Is anyone familiar with the provider network?
This would be Joeldin. Do you want to speak to this position?
Yes, of course. In network development, we contract with various providers. Earlier, I mentioned that we're here in Santa Clara County, which is our primary base, but we're also in San Benito and also Monterey County. So we're looking for the staff to help negotiate those kind of contracts, and also in provider relations, be that liaison to providers. Um, it's preparing that cost analysis to evaluate providers, and um, just having that personality to go out and talk to people is important.
Great. Is provider network experience a must?
It's always a plus. I think it's very important. Just having that comfort level to talk to a doctor or talk to a provider's office is important. And you during the interview process, once you just have that conversation to that staff, you'll know if it's the right fit or not for us.
That's great. Thank you for answering that question.
Sure.
All right, it's time to talk about the HR process. Okay, because I did get questions about how long does it take, what do we need to do to apply. So I will have my colleague share his screen. Thank you, that was fast. So this page is about the opportunity link. Everyone can either scan the code with your phone or type in the website to access the quick page we developed for the department. So can we move on to the next page? Thank you. So I would love to talk about the HR process timeline and what are the process. So the county of Santa Clara, so VHP is part of the county, and the county has specific steps of the HR process. So the first step is that we post our job postings online, but we do not keep it up on there forever. In most of the scenarios, we post it for 2 weeks, and there's an expiration date on the posting. So that's 2 weeks of timeline to apply. So each of the opportunity will require an individual application. So let's make sure to first create an account. So once you find that job, you have to find the job first. And once you find the job, you have to create an account online on our job board and submit your application accordingly. There will be some questions on the bottom asking you, do you have this experience? Can you elaborate? So those are for the application review process, which is the second step on the screen. So our HR analyst will be reviewing each of the application once the job posting is pulled down from the website. We will go through them one by one to make sure if the application meets the qualification, minimum qualification. That takes about 1 week or so. Our analyst makes sure that I tell everyone he reads very fast. He's going to make sure this is a fast process for everybody. So you don't have to wait. So we're very appreciative of that. The third step of the recruitment process is interview scheduling and testing. Some of the positions at the county will require written examinations or verbal examinations. Some of them is just simply the application review process. It depends. So each of them is different. So if we have the testing procedure, it may take longer, up to 4 weeks. But if we do not have the testing procedure, we're just gonna start interviewing the qualified candidates on there. And once the interviews are scheduled, we move into the interview stage. And at this time, I want to have one of our speakers speak to that. How are the decisions being made? What do we value during the interview stage?
Sure. Let me take that and add a little bit more to applying to public sector positions, because I think if you haven't worked in the public sector before, it's a little different than the private sector. So first, what are we looking for? I mean, for me, we want for something, one of the technical roles like IT, we do have a need for technical knowledge and experience. And for many of our positions, experience in some level is important, unless it's truly entry level. But what we often get many candidates with those attributes. What I look for when I'm hiring is passion about healthcare, curiosity, a willingness and a love of collaboration and working across an organization to problem solve, and really, really passionate about healthcare. I mean, if you want to learn about healthcare, especially how healthcare is financed in the United States, this is a great organization to be at, because you'll be exposed to so many different departments and so many issues and so much different types of work related to healthcare, that you'll come away with a really deep knowledge of health plans, which it'd be hard to get in a larger plan where there'd be a lot more silos, and you really would be only exposed to a limited amount of the plan. You will be exposed to a lot. So really looking for intellectual curiosity, being and wanting to learn. I think in healthcare, everything is changing all the time. So constant learning is just part of what it is to be in this industry. And so that intellectual curiosity is really important, because you need to stay on top of everything that's happening. When applying, I would say, I often, and I've often communicated back to my alma mater and been like, stop telling people to submit one-page resumes. In the private sector, I think succinct resumes are valued. People are looking through a lot of resumes, and you're often told keep it to 1 or 2 pages. In the public sector, it's really important to make sure that your application, your resume, is really, really both complete but really explanatory. So you really need to write down everything that's relevant to the job, and really spell out acronyms. Don't just put a bunch of acronyms. Really spell out exactly what that is. I've often explained it's like you're writing for someone who lives on Mars. You've really got to explain what you do in a public sector resume. And that's true whether you're applying to Santa Clara County or the federal government or the state government. The more you put in there that's detailed, and let me just emphasize relevant, you don't want to put a lot of irrelevant things, but really make sure that when you put down a job, you really describe in detail what you did in that job, what that position entailed, the skills that you have, the things you can do, the systems you know how to work on, so that, it's when that person's looking at your resume, it's really clear what you've done and what your experience is. And so I would say err on the side of completeness rather than on brevity, as long as it's all relevant and makes sense, right? You want it to be clear. And that's one thing, I tell this to everybody, and I've said this for many years, having spent, almost over 20 years in the public sector at this point. I just wanted to make that point.
I'm impressed. What type of CEO knows all the details about the application process and how you should fill out application? The CEO of VHP. Thank you, Laura, for that information. I appreciate
it.
that.
Many, many years of experience.
That was great. That was really good.
Thank you.
And yes, we talk about the application, we talk about the interviews, decision making, and the onboarding process is going to take a few weeks. We have to run criminal background checks. I'm not sure if there are health clearance.
Not on our side, okay. But definitely the background check is a requirement.
Okay, that sounds good. Hopefully this timeline can explain the process with everyone to clear your questions. And we're already at 12:18. I want to reserve some time to talk about our benefits. Okay. And everyone can continue to drop your questions in the chat, because we'll eventually get back to you either in the chat or later on. So I did get questions about the helpers, and people ask me, is VHP a helper organization? Or for sure it is. So the VHP employees are county employees who are entitled to all of the county benefits, and the county of Santa Clara tends to take care of each one of its employee, we have great generous benefits package. First of all, it's a transparent pay salary range. It's a blessing. All of the salary is open to public, and all of the numbers are laid out on there. We have calendared increases every year. We have very competitive health, dental, vision benefits. We're one of the few counties that runs its own health insurance plan. And guess what that is? Our Valley Health Plan. And it is contribution free. And this plan gives you access to county's own Valley Medical Center, Sutter Health, Stanford Hospital, free access for all of the providers. We have generous vacation sick hours, 13 paid national holidays. And Laura talked about the flexibility in terms of remote working because we value our work-life balance of our employees. Our package even continues after we retire. The qualified employees will get rewarded for their years of service. It's a regular stream of income that you will receive even if you're no longer with us for life. That is a pension plan that I told a lot of people about. So, and much more. I am not able to cover everything, but the county really takes care of its employees. And our departments also values our employees' well-being, just like what Laura mentioned. So join the team. Submit your applications.
Absolutely. And there's no copays for VHP. The only copays are $10 for acupuncture and $10 for chiropractor. Everything else, there's no copays.
Exactly. I am one of the users, and Joeldin
I am too.
So am I. I'm also a VHP member.
Yes, we're proud members of VHPs.
Yep.
All right. Anything we have not covered? Any other questions? Or anything we have missed? Okay. And there were also questions about management analyst opportunities. I think we have plenty of analyst opportunities.
Yes, there's a whole management analyst series that starts with, I think it's management aid, right, Oriana? And yes. Then it goes from management aid to associate management analyst to management analyst and then senior management analyst. Mm-hmm. And there's also a program manager series that goes from PM1, 2, and then up to program manager 3. So those are some of the codes that we use a lot for various roles. A couple of other departments that we didn't speak about was our Department of Accreditation, which is leading our NCQA accreditation, which is a heavy lift and a very prestigious designation to be an NCQA accredited plan. And also ensures that we maintain our HHC accreditation. So we have an accreditation department. We also have a strategic improvement department, which works with providers on improving the quality through measures like HEDIS and it's like a pay for performance program. So we're hiring actively, including for some analyst codes in that department as well. And so there's also a program manager too in that department. So those are some of the other parts of the that we're hiring for. Another really exciting area that we just started this year is our health economics team that is in our chief financial office, our CFO's office. And that is looking at both forecasting on trends, also looking at our benefit package. So for example, let's say there's a new benefit that comes. It could be a new drug or it could be a new type of surgery. This department would look at what those costs are, and then it would work like we talked about how everything is cross-departmental. If there's a new benefit, it may mean a new type of provider or more providers. That would then be a discussion with our provider network development department. Then we'd have to figure out what that contract would entail. We have to make sure that that's configured in the contract, and then that we can then pay the claim. All of this sort of circles through the department and it touches on everyone. And so there's some really exciting work happening in health economics as well.
That's great. It sounds like we're a huge department and we have so many different divisions and opportunities available.
We do. And those business intelligence analyst positions are really key as well to a lot of this analytical work. One of the really exciting things we started 2 years ago was a development of our own electronic data warehouse and bringing in some really fantastic talent to build that. And so that's nearly completed. It's actually like a self-service Power BI tool. So there's just been so many exciting things happening. We're not that big compared to like other parts of the county. We're less than 300 people. But it's really exciting to see like we're mighty and really punching above our weight. So it's been really exciting to see our growth and how we're meeting the needs of both our community, which does need the care and needs the access to providers, as well as being able to address healthcare is changing. It's becoming very data driven, and we need to be able to really tap into that data and have our own data in a way that we can utilize and make decisions based on. So it is exciting.
That's great. 300 people. That's a small business right there.
Yeah.
Yes.
And we've over doubled, I guess.
I think we've about more than doubled. Yeah.
Yeah. Prior to the pandemic, we've over doubled, and we've hired a lot of good key people in addition to the current people who we have had, and it's been a wonderful organization, and it's great. Come join us.
Thank you. Awesome. And we also do have pharmacy. We do have a pharmacy department as well as in our medical management department. We do hire pharmacists. We have pharmacists on staff. We also have some extra help pharmacists as well.
Oh, that's great. Thank you for answering that question. Yes, our audience was asking about the other medical professionals that we're looking. That's great. Okay, just looking at if we miss anybody's question. I would love to have our speakers address all of your questions before we let you go. Okay, we talk about the calendar increase and unions. We have questions about what the unions are supporting our department.
Yeah, our two main unions are SEMA and SEIU.
Mm-hmm. Wonderful. Sounds great. Okay. We're running short on time. Let's see if we miss any questions. Someone asked about what are the organizations that take our insurance. Stanford Health and Hospital, our own Santa Clara Valley Medical Center, O'Connor Hospital, St. Louis Regional Hospital, Sutter Health.
So Palo Alto Medical Foundation is one of, and that is part of Sutter. They're part of our network. SCIPA, the Santa Clara County IPA, PMG, which is the I always forget what they stand for. It's
Physicians Medical
Group of San Jose, right? And they're a very big IPA as well. And then Stanford is for quaternary, care because they're so specialized. Our other hospitals, so Lucille Packard and Stanford are both in our network. Usually you need a prior authorization, but that they're part of the network. And we also have VMC, O'Connor, St. Louis. And so those are also, and also El Camino is another hospital that is in our network. And then in San Benito County, we have Hazel Hawkins, and Monterey, we have Natividad, Salinas Valley. Help me out here, Joeldin. And we have one more, I think, in Monterey County.
Our network is so wide.
It is a big network. We have a lot of hospitals and a lot of providers and a lot of specialists. So I think we have 30,000 providers.
Oh, wow.
It's a big network. I think, and we've got a lot of specialists as well. And so that's been a big focus, is growing our network actually over the last couple of years. So Chomp. Thank you, Audrey. Yes.
Me Memorial.
Yeah. And Memorial, right. We have a number of hospitals as we move down into San Benito and Monterey.
That's wonderful. Thank you. I'm a proud member. I'm very proud. Last question. Yes, we have one more minute. There's last question about entry-level nursing opportunity. Do we hire new grads?
Potentially. I think I would say we'd love to have people apply. Potentially we could. I'm not quite sure. It depends on the role and what other experience they had.
Great. This is wonderful. And everyone, don't worry if you miss any information we talk about, because this session will be recorded. It will live on our social media sites. It will live on our website. And we just love to have everyone here with us today with your wonderful questions. And we welcome your application. We welcome you to join the team, to join the county, the big family. And we're at time. And thank you so much for everybody's presence today. Thank you, Joeldin, and thank you, Laura and Julie.
Thank you so much, Ryan. This is wonderful, and you've been fabulous. Thank you so much for all your help with pulling this together, and to the team over at ESA. Really excited to work with you on this. I hope people found value in the information. Please reach out. Please apply. Love to have you join VHP. Thank you so much, Julie and Joeldin. And thank you again, Oriana. Fabulous.
If you have any questions to the viewers out there, feel free to reach out to us. Maybe you're not comfortable with this kind of venue, but reach out to us, LinkedIn or call VHP. We'll help answer any questions.
Thank you.
Yes. Thank you so much.
Thank you. Okay, bye everyone. Thank you.